Good evening and welcome to the second of two Inside Government shows for the spring 2022 semester here at Cayuga Community College. This is a show that is on Verizon Fios, Spectrum, as well as ARMA, the Auburn Regional Media Access, as well as WIN 89.1, the college's radio station. I'm your host, Guy Cosentino. Our second guest tonight is not a stranger to the studio. She has been very gracious with her time. Even before March of 2020 when the COVID-19 pandemic appeared. But she has come in on a regular basis to give us health updates, not only on the pandemic, but other items. A lot has changed since her last appearance here. I think was it in mid-November. Omicron seems to have peaked and not disappeared, but lessened. The state has loosened mask requirements as of Friday, at least in a public phase, but still requiring some venues to be masked, including the area schools, this college, for example. And while we've had some spikes in COVID cases, deaths, and recently with deaths, it does seem that there is a decline in hospitalizations. We've asked Ron to talk about all that, and we also will talk about the flu, if we can, because that is usually why she's here, as to talk about that. Welcome back. How are you doing? How are you and your family doing?
Well, thank you. We're doing well. I appreciate you asking.
So everybody's healthy, you're just staying masked and...
So far, so good.
Okay. So I don't want to get too in-depth in numbers, but you did bring some numbers because we see a lot of stories every day, but I'd like to put them in some context. So where we are right now, where are we with the number of COVID cases that we have either had or have now in Cayuga County? So
there's daily updates that go out. We will probably be changing that to less than daily very soon. And we've seen a steady decline. There's in the hundreds marker right now, as opposed to multiple hundreds of people who are positive for COVID. And that's the cases we are aware of. We know that there's any testing that's done through laboratories gets reported to us. People may choose to report their home test to us, but there may be people who do not do any reporting.
So let's segue for a second. So Biden administration, you go to the White House website, you get those. We got some at our house. We've been, trying to find them at Walgreens or wherever, and you've been very nice on several occasions to give recommendations of, okay, go get there to get tested. For these home tests, do you think that alone is going to just skew your numbers because you're just not going to get people responding?
Without question. Without question. Okay. We are aware of people who may call and ask us questions and openly identify that they're not going to send in their test results, and they don't need to. We really want them. We want anyone who's positive or anyone who's symptomatic. Stay home and don't spread the germs.
So what are our numbers now?
Well, we've got any number.
So let's talk about cases. We'll deal with deaths later.
Okay. Right now, I can say so far in 2022, we've had 142 county residents who've been hospitalized either at Auburn Community, St. Joseph, Krause, or upstate in Syracuse. Those are the four hospitals that we query on a daily basis.
And do we know if those people, do you have a breakdown from those people of who are vaccinated versus unvaccinated?
I do. I have to thank Molly in our office for pulling these statistics together for us. Of the 142 residents thus far in 2022, 50% had no vaccine, 32% had not been boosted yet, 5% were not eligible yet for a booster, and 12% had received their booster shots.
So if I do my math, and I'm not necessarily good about that, Mr. Ledouce would attest to that when I was in the 8th grade, it does look like that those who are fully vaccinated, which would be 12% of that number, it's largely people who are not fully vaccinated or have no vaccination at all.
Who have been hospitalized, correct.
And what do you count as now being fully vaccinated? Because I know, the CDC and Dr. Fauci were all getting this question when the third, so I have my third. I'm fully vaccinated, I am assuming by the definition, but was I fully vaccinated when I just had two?
We count completing your initial series. So it's typically two if it's Moderna or Pfizer, or it was the one,
J&J.
2 weeks after you completed your initial series. That's considered fully vaccinated.
So in the last, Omicron seems to have been on the decline. Deaths did not catch up with that on the decline. If I remember correctly, you've had 6 in the last week. That number may have changed since I did my questions last night. So where are we on deaths?
So I brought numbers from the beginning of the year. And since January 1st of this year, we've had 22 deaths reported to us that are associated with COVID as a cause of death. 10 of those 22 were people that were unvaccinated. 6 of those 22 are people who had not received a booster. 3 of those 22 were not eligible yet for a booster shot, and 3 of those 22 had received their booster shot.
So again, a much even smaller number. So the case is still made, go get vaccinated.
Yes.
The data.
The data is showing us that having your booster shot is absolutely helping still to prevent hospitalization, still to prevent death. Even if you didn't get your booster, it's beneficial, but it's better if you do get your booster shot.
But still having 163 cases last week is still a high number.
I think so.
Okay.
That's reported. So we know that's the tip of the iceberg.
Right. So is there any, I don't even know if anybody can model this. Do they have any idea how you would model that for a county?
That's beyond my scope of knowledge right now, but I know that there's all sorts of studies being done in anticipating how they might be able to.
So where are we on the vaccination front? I know there's some numbers I can share, but I'm thinking yours are better than mine.
Well, we rely on our state, on New York State Department of Health.
And you can look this stuff up on the Department of Health website.
Correct. And my numbers, when they're state versed, I'll say that the ones that I just gave on hospitalization and deaths were based on Cayuga County statistics that we maintain. So the vaccination data is state-based, and that's reported because every shot that's given has to be reported through a state database.
So versus an employer who might have to guesstimate, I know in the case of when Jeff Parazola was here once, he's just said, some people got vaccinated before we even started collecting data, so we don't even know what that number is. So you're talking about this is state data versus an employer data.
Anytime an injection of COVID vaccine was given, it needed to be reported to this database, regardless of who administered it.
Okay.
So I've got a number of age range breakdowns.
But what overall? Where are we overall?
59% of our county population is vaccinated.
Okay, so the state website I saw said 63, but they also show a 90 that we're 17% below the state average.
We're definitely below, and so I'm talking about the county population, and this is data that we pulled up. This may be of the whole, right? You may have based on who's eligible.
Oh,
right?
Okay.
And so that would be 5 years old and up.
Because can I tell you, I looked at 3 different websites and all 3 had different numbers.
Yeah. So correct.
Okay.
And I think that's a fair frustration.
So 59 is low.
I think so.
Okay. Before we get to why that, there seems to be, that's a wide gap. There is also a wider gap, it seems, with 5 to 18-year-olds. Am I correct on that?
Correct.
So what's that number?
I have it broken down in increments. So for 5 to 11-year-olds, we have about 27% fully vaccinated versus the state's 38. 12 to 17-year-olds, we have 57% fully vaccinated. That's pretty good, but it's compared to the state, it's 76%. 18 to 25-year-olds, 59% versus 85% statewide.
So we are way below. So when you look at this, is there well, first of all, do you know why we're lagging in your mind? Not like we're not talking about it.
It's not like we're not talking about it. There's no question we're trying to ascertain that. If we knew the answer why, I think we could address it better. We know what we hear anecdotally. We know there's questions about the vaccine. Well, we can address that. Healthcare providers can address that. We know there can be access issues. Well, we can address that, and we have been addressing that. Pharmacies provide it. Healthcare providers provide it. The health department does, and we go throughout the county. We know, not a secret, this has been a very politicized issue. And I think COVID response in general, unfortunately, has become very politicized since the onset. I'm very hopeful that we'll see an increase as time continues.
So do we know if there's a lag? Is there a lag by, you and I had this conversation, I think, at ABCQ when they opened, what was it, last summer? Mm-hmm. We were talking a little bit about geography. So at that point, at that point, your worry was the city was doing pretty well until you got into high poverty areas of the city, so the west end of the city. You had closer to the donut towns, you had a higher rate, and this is before 5 to 18-year-olds, I believe. And then when you got out into the more rural, the numbers drop off. Is that still the metric?
Still the case? I haven't checked our zip code data lately. More than likely, it may be. But I tell you that it's not fair to make that as a generalization. For example, we try to go out throughout the county, and we were at Southern Cayuga School District providing vaccines not only for their students, but for residents in the area. And there's a number of farm laborers who live in the area. What a great job that school has done. And they have
and you're having
huge rates.
We're going to get in New York Vax right now. This is the goal to vaccinate 5 to 18-year-olds. You're doing a clinic there tomorrow in Southern Cayuga. So they're inviting you in. You've done 2 already?
We have. And there's been a variety, right? We continue to do that. I mean, we've gone to Port By. Our schools have been wonderful partners in accommodating us, as well as in trying to get the word out of the availability of vaccine. So I can't speak highly enough. And I select out Southern Cayuga because they've just been such a proactive school district. But our other school districts certainly work positively too.
And again, I'm not pinning you down on this, but do you think you have a higher percentage of people vaccinated in the Southern Cayuga school district than you do in other areas?
Yes.
Just because?
Because of their actions and their proactive approach.
So is it really, this is a general, specific question. What can Cayuga County, your department, do? But more importantly, what is possible to do to raise this? Or is this really now in the hands of health providers, pharmacists, school districts, friends, cheerleaders?
Yes, to every identity, every idea you just mentioned. Absolutely. It's those one-on-one conversations that will make a big difference. We're also fortunate that we received some grant funding. I think we'll see some marketing, that we can hire some professional assistants to help us market to some of the demographics and zip code areas that have lower rates of vaccination, and we hope to see some benefit there.
Are those lower rates of vaccination in those areas, when you have looked at the data, are they much different than, say, flu vaccine? Are they the same people who don't get the flu vaccine?
Yeah, and I would only be speaking anecdotally to that. I don't have data based on zip code for flu data. We know that there are some people who have a general worry about any vaccine.
Right.
There are some people who hit and miss any given year.
Okay.
So it's amazing when you say there's a scarcity of something, the demand goes up. Right. So if you remember in past years when there was word that there might not be as much flu vaccine available initially for people, suddenly everybody wanted it right then.
Okay.
So it waxes and wanes.
So I want to go back to children, because that's in 2 groups. So there's this 5 to 11-year-olds. It looks like 22.9% roughly have at least gotten the full dose, and a little in about 5%, about 27% have 1 dose at this stage, and that's about 10% below the state average.
Yes.
Is that pretty good? Is that better than you? I didn't say it was good or great. Is it pretty good compared to where you are with adults?
No, our adults are a higher percentage, but it's hard. It's hard to say because of the duration of time.
But I'm also saying you're closer to a state rate. If you were just judging it by the state, you're closer compared to the adults.
For the most part, except our older population, our 65 and older age group, they've done great getting their vaccines.
So I want to ask you about gender. So So obviously, once you start looking at these charts, it's really interesting. You start clicking through. So I know there's a gender difference, maybe 3 or 4%. Women tend to get the vaccine more than men. Mm-hmm. I also would say that would be about life in general, that women tend to take care of themselves. Whether I'm being sexist or generalist, women tend to take care of themselves and get the proper shots and all that stuff. Men lag behind all the time.
I would say that it's reflective in other statistics we've looked at for healthcare access.
So what about children? Because the big issue has been this issue of, so I would say out of 20 children I can name right now, if I said 10 boys and 10 girls' names, all at the age of 9, because that's what I'll know, most of those boys have gotten vaccinated. Some of the girls have been vaccinated, but a larger percentage of girls have not been vaccinated. So a reverse of that gender of the overall population. Is that something you're seeing or you don't have data on yet?
I don't have data on that for children at this point, and we know that often it is, and this is stereotyping, but it's, again, what we've witnessed also. Very often it's the moms in households who are helping make some of those healthcare decisions for children. So I think that's where it comes down to having these conversations and having questions answered.
But there is no data right now that says that any of these vaccines impact fertility for boys or girls.
Correct. There's been some studies, and actually we want to make sure that people are looking at credible studies. Right. Don't go to a .com site to get your information.
Facebook is not
credible information sources, although it might be used as a venue to promote some credible sites. But look at the research journals, look at CDC, look at the medical journal, the New England Journal of Medicine,
Lancet,
look at JAMA, okay. Look at Lancet.
So you have this new program called New York #Vax. This is for children. Okay, and who is running this?
So it's an initiative from New York State to increase our number of children. Back in the fall, we had Vax to School, and now we have Vax for Kids. And it's the same. It's really trying to encourage families to get their children vaccinated.
And you've done 2 clinics. You've got one tomorrow in Southern Cayuga. Is that by appointment or is that by walk-in?
We do both.
You do both. Are others planned?
Oh, yes.
Okay.
And we have a website, the cayugacounty.us/health, where if you click on COVID, you can be taken to all the clinics that the health department is offering. But again, there are other partners in the community that are offering vaccine. In talking with the hospital, some of their AMMS practices, they've got a real coordinated effort to have their children go through one practice and their adults go through another practice to try and help streamline and not waste vaccine and provide the accurate information people are looking for.
And were you, has nothing to do with Cayuga County, but were you surprised that the review process on the vaccine for 5 and below, I don't want to say it's been withdrawn, but it's been put on hold. Were you surprised by that?
I'm heartened by the fact that they're putting a pause while they gather more research and data. That's how it should be. That gives me more faith that the process is being done correctly, that it's not being rushed, that we're really looking at the information.
So I want to ask you a little bit about the county, your department's work in this area. So you have stopped contact tracing, correct?
We have, yes.
Why?
There were a number of factors that went into it. Primarily as we came into the new year and we saw the huge surge in Omicron-related illness, the time that it took for a test, we got reported of a positive person, to then get the names of the contacts, took up the time that it may have been that you were now, if you were my contact, you're now showing symptoms. So the incubation period for Omicron variant was shorter than the Delta variant. So by the time we were reaching out to contacts, it was really after the fact for a lot of them.
So it was not
effective.
Is the only group that's doing contact tracing school districts now?
School districts definitely keep track of who their students are in contact with. The state is still providing information. We still provide information, but we encourage people to communicate with the people they're in contact with.
But there's no firm policy that every district is doing. It's labor intensive.
It is labor intensive, but the schools really do need to keep track. Very little has changed to help lighten the load in our districts right now.
So are you doing testing still as a county?
The county health department is not providing the testing directly, but we do have a state site still in Moravia that's providing testing. And we know that at healthcare provider offices and pharmacies,
you can go to a
and
pharmacy.
urgent care centers.
And how about that? So obviously there's the Southern Cayuga, the Vaccinated. Are you doing other vaccine clinics too? Or are you done with vaccine? Is the county not distributing, or are you relying on pharmacies, for example, or hospitals?
Oh, absolutely. We want them to provide vaccine as well. Is that
But is the county still doing vaccinations besides just children?
Oh, like measles, mumps, or for adults?
COVID, no. Are you doing the COVID vaccine for adults still?
Absolutely, yes.
Okay. So
yes.
Where are those occurring?
Those are, again, they occur around the county. If we go off-site, we open this up to adults also. It's not solely for children. During the school, there may be an hour that we set aside just for children, but then the next hour is open to
so somebody
adults.
Can go to those. Okay.
Yeah, and at Finger Lakes Mall, we are hosting sites as well.
So I want to ask about masks, because that is, from when I asked you to come here to today, it has changed. The governor changed last Friday the policy. So where are masks required and where are they not required as far as the county health department is concerned?
So it's a lot of the regulated facilities that still, and state regulated facilities. So healthcare facilities, for instance, of which the health department, local health department, is a regulated state facility. So we wear our masks at work in our office. But when we go outside, we do not have to wear our masks. Congregate settings, a lot of times, schools are congregate.
So schools, the colleges. Mm-hmm. Do you think that, the governor has indicated, or her press people have indicated, that she's going to revisit this next month? Do you think she'll lift it for those other entities?
I think it's going to make a difference to see what our numbers look like. So when we look at schools, we have traditionally seen in the short time period, 2 years that we've been dealing with COVID, after school vacations, we see an increase in cases amongst school-age population. That may still happen. If our numbers continue to go down, places...
Well, I was going to ask you about that. So she released the mandate was released for the general public, not these schools and special exceptions, last Friday. Do you see a spike coming next week or by the end of this week into the next week? Because you go to most stores. I mean, I wear a mask in a store. I don't care what people think. I really don't. So you thinking that you're going to get a spike?
If I were to bet, I'd say we won't see a tremendous spike in the general population. Again, we're basing that on what's reported to us, because I think the symptoms overall are a little less so with this current variant. And I don't think that we interact for a length of time a lot of times when we go to the grocery store. But we certainly saw when things opened up, like bars are back open, restaurants are more and we're all glad for that. We saw a rise in cases, so it could happen.
If she does do you think she should reverse the decision on, or should she remove the masking requirement for schools at this stage, or do you think
I think it's wise to wait. Personally and professionally as the public health director, I think it's wise to wait and see what happens after the school vacation.
As far as you're concerned, the data does say masks works.
Correctly? It's so clear they're a physical barrier that prevents droplets.
So you're encouraging people to wear masks?
I'm encouraging people to identify their tolerance for risk and absolutely don't feel intimidated to wear a mask. It's not a bad thing at all.
So my worry is that people are going to be the peer pressure. You walk in and you're the only one in the store. I go to a gym and I'm the only one wearing them. And not that I go to the gym to work out, but I go to the gym with somebody else. Very few people wearing the masks now, especially after Friday.
Right.
Do you worry that peer pressure is going to drive people to not not assess risk factor as much as I don't want to look like I'm not one of the crowd.
I think that's unfortunate if that's the reason why people don't wear a mask, if they are more comfortable doing so.
I do not want to get into the whole issue. I didn't ask the chairman when he was here. There was a whole go around with enforcing the mask mandate, not enforcing the mask mandate with the county legislature on January 1st when they met. That is a moot point now because of what the governor's done. One of the questions, though, that was out there was if the county did not enforce the mask mandate, you would lose outside funds. I think they were federal and state funds. Mm-hmm. Has the county lost any money?
We did not.
Okay. So is this over?
No. COVID is not over.
Are we over the worst of it?
It's too soon to tell. You know, I was talking with some of our staff in anticipation of this coming to your show, and they raised a good point. You know, with flu, we see seasonal. Right? With COVID, we've seen waves, and we've been surprised before. Last summer, most of us thought we might have a summer of low numbers, and then end of July, August, we saw very high number of cases.
So what do you see as the new normal, for lack of a better worded phrase?
We're still figuring that out. I think it's too soon to say, to be honest.
So stay safe. It's here to stay in some format.
In some format.
And be cautious.
Absolutely.
Do you see boosters as being just a regular part, just like we're doing with flu every year?
That won't surprise me one bit.
So I want to talk about flu before you go, because that's why we normally hear. So any idea what percentage of people have gotten the flu vaccine?
I don't know.
How about who've gotten the flu?
I have some numbers on flu cases so far for 2022. Well, for this flu season, not 2022, but the 21-22. We've had 52 cases reported. And we know that flu is being tested for when people are going to their healthcare offices, because we want to rule out, is it COVID, is it something else?
So 52 high or low?
It's low. It's low.
So you were really low last year because everybody was wearing the mask.
Correct.
So wearing the mask also reduces the flu as well.
It absolutely does.
Is it because the shots that we all got in the fall, I remember going to Dr. Graney, is it because they're working better, or is it because we're all just wearing masks and we're being safer?
The flu vaccine has been effective, but there's no question that wearing masks has helped prevent the spread.
Is it too late to get the flu vaccine?
It is not too late.
So what's the window? I know I walk into the doctor in October, late September, and they start talking about what's the period you want to have for getting that.
So our medical director will tell you that you can have it right up through the end of the season, right? Through April is not inappropriate to get it. And the flu season is highest for us in late fall and winter. If you travel, you may get exposed to it elsewhere if you travel outside of our country. So,
do we know anecdotally that because of COVID, that more people got the flu vaccine only because if they were getting the COVID shot, somebody was in their ear saying, you might want to get the flu shot as well?
That's a great question. I don't know the answer to that, but we do know that it was perfectly acceptable to get your COVID shot at the same time you got your flu shot. So I like to hope so.
And you still want people to get shingle shots if they're of a certain age?
We're huge proponents of vaccines. Vaccines are so effective in helping prevent disease, communicable diseases, not as communicable like shingles. It's really, really important and a huge benefit to public health. Vaccines are.
Love to have you come in and talk about something that's not COVID related. You know there's an open door for you. Your staff has been here on prenatal care and other things. Love to have the health department in here to talk about non-COVID things.
We look forward to it.
Our guest has been Kathleen Cuddy, the Cayuga County's Director of Public Health. Again, want to thank her. She has been a regular guest here throughout all of the pandemic and giving us an update, and we appreciate her work, not only coming here, but also the work of she and all of her department. We do encourage you to get vaccinated if you have not, and to wear a mask. At least I am recommending that. We don't have shows next week, the week of February 21st, but we do return throughout to March for all of our Tuesdays and Thursdays. We have a number of guests already slated to come in the studio. Senator Pamela Helming will be here. Cayuga County Community College President Brian Durant will give a college update. and I'll have some news for you as well. Auburn Housing Authority's Stephanie Hutchinson will be here. The United Way's Catherine Dennis will talk about their campaign and as it wraps up. The YMCA's Melissa Cartner will come in to talk about one of the happy things in Cayuga County, and that is the Y Camp and what's going on with the Y. And we'll have the Auburn School District's Jeff Parazola and Lisa Green in to talk about the proposed budget that will go before voters in May. We'll also be having our annual Auburn Large School District Forum on May 3rd in person here in the studio with Jeremy Boyer. Before we go, though, we would like to let you know that you can send your ideas for guests or questions to Inside Government. It'll be on the front page. You can send your questions to cozguytho@aol.com or Inside Government, 141 Dunning Avenue, Auburn, New York. I'm Guy Cosentino for Cayuga Community College. We hope you will join us when we return the first day of March with our shows. We hope that you have a great tomorrow. You're safe. Go out there. Stay masked if you can. Get your booster. Get your vaccine if you can. Thank you and good night.